standing so we can get a sense of this really fascinating complex. The hips are like anything else in our bodies. It's a joint. It's built for mobility and stability. Shoulders are just mobility, really, but the hips, they carry the whole upper carriage. So I invite you just to toggle from side to side and sense. Does it feel even? And let your body come to stillness. And notice as you tip the pelvis forward and tip it back, is there one position that's more easy? So now keeping the legs relatively still. So anterior tilting the pelvis forward, and posterior tilting the pelvis back. This is what I call the high school slouch, because everything is really short, and if the hamstrings are really short, that begins to pull the whole pelvis complex down. Hey, Roberta, good to see you. But if we sit down a lot and we sit very proper, the hip flexors on the front tighten. If we wear, I don't see that as much, at least that's probably says more about me than about, if we wear heels a lot, these also tighten. So today's work is going to get this whole complex sorted out. When the pelvis tilts forward versus when it tilts back, notice what happens in your low back, the lumbar spine. It begins to get congested. I see the disc herniation, bulging discs and herniation. It is right in this complex a lot. It's L5, that's the last one, S1, or L4, L5, very common. Then, of course, we have the sciatica thingies that also starts from the spine. If there's a lot of congestion in this area, the nerve roots that comes out and travels down to the legs begins to get compressed. And then we did this little event too on Monday. As you stand, take your hands to your hips. Not your hips, your waist is what I meant to say. Now keeping your knees straight, and then lift your right heel and lower it down, and then the left. So just go from side to side. So in the waist we have the internal obliques. We also have the hip hikers on the back. So as you hike the hips up, is it evenly easy? Or does one side hike better than the other? Or is your body trying to be helpful by bending the knees so that we are not accessing these muscles? We're going to work a lot on those today because they are a part of the trouble is what happens a lot in the hips. So with that said, let's come onto our back and do our supine assessment. So I invite you to start flat first. And as you take a load off, so to speak, coming onto your back, notice, and this first just sense it, but then lift your head and look, does your leg roll out evenly? If one rolls out more than the other, we know there's an imbalance in the hips, that one is tighter than the other for whatever reason. It could be surgery. It could also just be habitual. How we use our bodies, we have a dominant side and a not so dominant. Notice your butt cheeks. Do they rest evenly on the floor? Maybe one lays a little flatter than the other. And that can have a couple of different causes, well, probably more than a couple. But one is we use one more than the other, so that holds more tightness. It can also be that there is a rotation of the spine. So wander up to your rib cage and just notice, does one side lay lower than the other? If there is a rotation, that side will press down into the floor a little bit. And now we're going to just go back to the sacrum. Are you resting towards the tailbone or the center of the sacrum, so the 5 fused bones that holds the iliums in place? The iliums are the hip bones, one on each side. And also, how much space do you have behind your low back? Does it lay really flat, which may mean that you're laying more on the top? That could say more about the hamstrings, that the little tight holding the hips down. Could also be some spinal stenosis. Or is the low back lifted up so you are at the tailbone and you have a lot of space behind the low back? That's my structure. That's one I know very well. I was extraordinarily swayed back as a kid. It's like I lived in 2 different counties. So that's part of what my body knows. And we all have these default places. Let's bend up the knees. And now with the knees bent up, we took a lot of the strings out of the equation, both from above and below. So as you come to rest centered on your sacrum, is the back of your head also centered? Or are you resting more towards the top of the skull or at the lower part? So ideally, the furthest part back on the skull mimics the sacrum. When we sit, when we walk, so that they travel on the same plane. Again, that's in theory. For most of us, not the case. Let's place the hands on the low belly and begin to try and settle into the breath, the diaphragmatic breathing. And do so without forcing. Notice, is it a little tight? Invite the out breath to be slightly longer than the in breath. Notice the body receiving the breath. Can you sense it not just into the abdomen, but also sensation into the pelvis, and maybe even into the legs? The pelvic diaphragm mimics the breathing diaphragm. So as you breathe in and the diaphragm moves down to allow the lungs to open up a little bit more, the pelvic diaphragm moves down as well. And as you breathe out, everything slowly floats back up. But our pelvic floor muscles can become really tight or really lax, and we lose this movement, which means that everything in the pelvis is kind of a little bit stuck. That's an integral part of our pelvic stability and hip stability. I worked with a student who had a lot of plantar fasciitis and hip pain, and it all originated because of the imbalance of the pelvic floor. But it's an area in our culture, we're a little bit afraid of it, so we ain't gonna go there. But no amount of foot massage was gonna solve that issue, so we need to follow the strings. Where does it originate? Now begin to make that drawing up a little bit more conscious. So as you exhale, draw the pelvic floor up. So it's a little somatic for the pelvic floor. And then relax as you breathe in. Again, breathe out, draw the pelvic floor up. Maybe a sense of the sits bones move a little closer together. And then slowly relax as you breathe in again. So the muscles, we're just going to talk female anatomy today, as I did on Monday too, are controlling our three openings. So it's not just one muscle, it's a really beautiful network of muscle. There are three layers. And if you take your hands and just hold them on top in front of your face, place the thumbs and the index fingers together, so you create a triangle. And where the thumbs are, that is your anal sphincter. In the middle-ish is the vagina, and then at the top, towards the top, is the urethra, which is the smallest and also the weakest of these areas. So now I invite you just to contract the anal sphincter towards the bottom. And it invites the others to follow. You can relax your arms down and it'll keep that visual in your mind. Relaxing and control of this muscle, well, all of them is a really good thing, that as I think we all agree on. And now do that again. Contract. In yoga, this is called Aswini Mudra. And relax. Now let's move to the opening of the vagina. Contract, drawing upward. So it's different from Aswini Mudra. Though again, it bleeds out a little bit into the other two, but different muscles. One more time. And then the urethra. Can you sense how this is different from the other two? This is a cue that's often given for Kegeling, which in my opinion is not the best, because it really doesn't involve the whole story. But if you have difficulties with stoppage, yes, but I would say this one here, and especially they say do it when you're using going number one. You don't really want urine to back up in the bladder. Once it's going out, it needs to continue going out. Now, let's have some fun. Contract just the right side. Just the right side. And then let that go. Now contract the left side, just the left side. And then slowly relax. Do they feel the same? For most, they don't. Again, dominant side, non-dominant, injuries, surgeries. So let's go back again to the right, contract. Notice of those bumps, hiccups in the contraction. Just stay on the right side. Contract. Relax. So through the repeated movement, that's when we begin to create that healthy loop. Signal from the brain to the muscle. Muscle says, got it. So sometimes a little bit of retraining, it doesn't take long. It really doesn't, but we have to know what, where, and how. All right, let's switch to the left side. Contract. Release. And one more time. And we'll go back to center. Do all of it. And as you draw the pelvic floor up on the out breath and relax on the in breath, notice that is an invitation to the arch and flatten. Don't make it a huge arch and flatten. Keep the mind on the pelvic floor, what's doing, but invite it into a flattening with the hollowing out of the belly. And as you inhale, gently rocking into the arch, belly expands. And exhale, gently contract, pelvic floor, mula bandha, lower abdomen, uddiyana bandha. If you're lifting something heavy, coughing or sneezing, this moves the energy upward as opposed to downward. Which is really helpful. Sometimes this is all that's needed for pesky low back pain or inner groin pain. Gently and easy. And then after the next one, slide your legs out long. Pause. As you breathe in and out, notice, has anything changed in how you breathe? The low back or the hips? And roll the legs in and out. And then bend up the left leg. And play a little bit with the hip flexor. So that's a continuation from last week. Slide the right leg up, so sliding it straight up, and then draw the knee into the chest. And then release the foot down again, slide it out long, and relax. Take a breath in, full breath in and out. And we repeat. Slide the leg up. And releasing it down. Sliding it out. And relax. And sometimes that does take more than one breath because the mind is already on, well, I'm going to do it again, so I'm not going to relax completely. Do it one more time. Sliding up. Releasing down. And relax. Slide the left leg out. Take a breath. Set. So listening to your body. Still anything, it's not something holding on. Can you relax it? So we are always gathering data. Bend up the right leg. And then we'll go ahead on the left. Draw the knee in. Relax the leg down, sliding it out. And as always, I invite you to close your eyes and relax completely so that your awareness is inward. And repeating. And then lowering down. Lengthening out, letting go. It's like a little reset button for the hip flexors. When we walk, if there's a lot of discomfort in the front of the hips, what's not firing? So right now it's completely isolated and we can study it and then we can rehabilitate. One more time. And then slide the right leg out. Roll the legs again. Just bend up the knees and roll over onto the right side. Sorry, left side, right. Well, I am rolling onto my right side. I'll get it straight. Bend up your bottom leg. So for me, that's my left leg. And straighten your right leg, the top leg, that would be the left, wouldn't it? Straighten the top leg out completely so it's down alongside. So I'm all the way up on the side, not rolling forward, not rolling back. So a neutral spine. And then just relax your top arm on the hip. Relax the top arm on the hip. Now reach the top leg out and then relax. Reach the heel out. So we do this on our back sometime. Relax. Now draw the top hip up towards the shoulder. The foot may lift up a little bit. And then slide it back out long. Draw the hip up. Now your hand, you can feel these hip flexors, not hip flexors, the obliques again are firing as you draw the hip up. And out long, lengthens out. Back and forth. When we begin to lose disc height and our ribs and hips begins to move closer and closer together. One of the reasons we lose the waist, because everything compacts down. So get space by having these muscles that's contracted so tight, release back out again. Now, let your hand come down alongside because we're going to begin to pull the shoulder down towards the hip as you pull the hip up towards the shoulder, and then relax everything out long. And draw the hip up, shoulder down. So that's the ribs. So now we get the external obliques. We also get the intercostals, the muscles between the rib cage. Ribs contract, lengthen out to normal. I'll do it one more time. And relax. Now draw your right knee. No, the top leg. That'll be the left if you're on the same side. Just on top. So this is not the 90-90 proposition. This is for the clamshell. So your heels are lining up with your hips in this event. The muscles we're going to talk to are the piriformis and gluteus medius. Pesky boogers. So with the hand on the outer hip, as you lift your top knee up, feel these muscles engage. And then super slow, lowering down. Gluteus medius, that's hip stability. Piriformis, that one is just a pain in the butt, literally. Sciatica pain can originate here. Just take a breath in and out. And then lift again. Are the muscles firing? So make sure that you're not rolling onto your back, that you stay right up on your hip. It's very tempting to get more hip mobility to let the body change position. The lifting, engage the muscles, feel that, check. And slowly and controlled, releasing. Notice those bumps, jitters. Gives us some information about some tension that we hold in these muscles. Once you come down, let everything release. And then repeat. This is also what's called the clamshell, and used if you go to physical therapy for your hip pain. This one here is often prescribed, except very differently. You'll be told to maybe do 3 sets of 15. So we just bang them out. And we may actually, we get strength, but we also may get more imbalance here. We are both strengthening the muscles, but we also release them to the right tension. Let's do it one more time. And releasing. And then rolling over onto your back. Pause. Breathing in and out. And we're going to go to the other side. So starting with top leg out long, bottom leg bend up, And it can be tremendously helpful to place a hand on the waist, because then we can actually feel, yep, things are happening. Lengthen the heel out first, get a little longer, and then relax. And again, lengthen and let go. One more time. This one is going to be our invitation to now hike the hip up. Slide the hip up and then back out long. Or things contracting, helping with this movement. Is this the easy side? Or is this that other pesky side? We may be surprised, or it's like, why, I don't know, it's my left knee, it's my left hip, it's my left shoulder. Restriction in one area pulls on everything else. So these bands of tissue, it all matters. Now let's release the hand on top of the hip and then draw the ribs down towards the hips as you pull up. So now we get the whole side seam. Contracting between the ribs and then down and lengthening back out. Let's do one more. And then let everything relax. And slide the top knee up onto the bottom knee. Outer hip. So outer, I was going to say, you can say outer rump too. As you lift the top knee, do they fire? Slowly, 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 lower down. Slow and easy. Get the parts on board. Staying right up on your side. So pay attention to your floor hip. Does it lay completely still? One more time. Slowly release. Let everything relax. And then let's come onto our belly. And rest in a way that's comfortable for your neck and for your head. It may be forehead on the back of the hands. It may also be, if you feel that your neck is really getting jammed, slide a blanket under your chest so that your neck has adequate space. Draw the hips towards the floor. So it's a little posterior tilt. And let's bend up the right leg and draw the heel towards the tush. Like it's the upper part of the hamstring. Like I said, they attach to the sits bones. And now slowly lengthen the leg up. Keep the hips drawing down so the pelvis is not moving. We're isolating it. Letting the foot come down. Everything pulls. And we'll repeat this one more time. Draw the hips towards the floor. Pull the heel in. And slowly release it out long. Letting it pull. Left side. Bending the knee up. Feel the hamstrings contracting. And slowly, without lifting the hips, so keep the pelvis drawing down towards the floor. One more time. Slowly releasing. Let everything go. Now spiking the hips down again and lift the right leg, straight leg, lifting it up. So that's gluteus maximus. So lifting the leg straight knee, and then slowly release down. So it's not a big lift. Feel the glute saying, okay. Now let's do that one more time. Press the hips down, lift the leg. Glute engage. And then we release it down. Slowly, 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 slowly. Lazy glutes are, again, another common player for back pain. Let's do the other side. Press the hips down, lift the leg. As slowly as you can. Remember, this is one of the biggest muscles in our strongest muscle in our body. Not the longest, but the strongest. But woefully underused. Often. Let's do one more time. Press the hips down. Lift the leg. And then slowly, slowly, slowly lowering down. And relax. And then find your way over onto your back. And relax the legs out long. Pause and feel. Let's bend up the knees again. And then relax. Release, better word, release the right knee towards the floor. And then lifting it up. So here, be really mindful as you stay completely still in the pelvis, pure hip movement. When the sensation changes from a release to a stretch, re-engage the muscle, lift the knee back up, maybe not all the way, but enough where you feel these muscles are firing, and then lower down again. Right, these very dainty and gentle brush strokes. Keeping the pelvis centered so you can feel the sensation of the sacrum as you lift and lower. Does that stay completely still? If there's a lot of rocking from side to side in the pelvis, don't go so low. Back and forth, slow and easy. Because if the pelvis is rocking to the right with the leg, that stops. Nothing else is going to happen in these. It's called the deep six muscles. And they lay very deep and they're small. Let's switch to the other side. Slow and easy. Make it enjoyable. This is an enjoyable exploration. In the Bhagavad Gita, God says to Arjuna, the warrior, he says, be not attached to the outcome or the fruits of your labor. Enjoy the labor for the sake of the labor. And I know that sounds a little hokey because if I'm not going to get anything out of it, why am I going to bother? My intention is to help restore, rehabilitate, or just maintain healthy hip mobility. So we all going to be a little bit attached to the outcome. But do enjoy the movement. And once you come up, let's hook the right leg over the left. Take the arms out to the sides. And then we'll dip the knees towards the right side. And exhale, up again. Again, dainty, gentle brushstrokes. Sense a little bit of an arch when you inhale down. Now you are rolling over onto or towards the right hip. So we invite twisting or rotation of the spine as we work on the side seam. What is releasing and what contracts? And as you come up, next time, just take your time, move slowly and deliberately, and switch. And take it away. Let the movement build, each one on the one prior, facilitating wellness each time. Inviting yet more ease. The opposite of accident or injury. Which we are probably all going to be subjected to, one way or the other. Whether it's stumbling over a curb, falling over a rug or animal, or falling off horses or car accident, it happens. But then we begin the rehabilitation, restoring. Which is what the body is intended to do. And then as you come up, let's relax. Unhook and slide the legs out again. Pause. And we're moving on to the bicycle. I call it that, but you can call it whatever you want it. That is not everybody's favorite. I'll just put that out there. Press the right hip towards the floor. Not a big movement. Relax. You can place your hands on your pelvis bump on the front, and you can feel the right traveling down and then returns up. Pressing it down. but the left stays relatively still. So this isometric movement is available. We have 3 joints in the pelvis: the pubic joint, pubic symposium, which I think is a very funny term, and then of course the 2 sacral joints. And each one of these 3 can cause a lot of calamity. They can get locked and stuck or unstable. Now move the right hip, lifting it up instead of pressing it down. Again, very small movement. So the knees are bent up. But the knees stay relatively still. I mean, the leg bone is going to follow. Can you feel how when you do the lifting, that's your psoas, deep in the belly, that facilitates this movement? And let's go to the left side. Press the hip down and relax. How does this side feel so far? This is part of what happens in the pelvis when we walk. They have to be able to turn independently of one another. Sense how the left one is rocking slightly back and the right, that's pretty much hanging out on its own volition. You all, I know, remember the pelvic clock. Very similar, except we're working in a different plane. Let's lift the left hip and relax it down. Can you lift the hip without pressing the foot into the mat? The invitation comes from the spine, not the legs. And then letting that go. For the finale, drawing the right hip up and then lifting it, beginning to pedal forward, so towards the feet. Press the right hip down and then drawing it up again. So right hip, star of the show, but of course the left, and with the hands again on your hip, the left is going to be doing the exact opposite of the right. As you are slowly motoring forward. So instead of walking on your feet, it's like you are walking on the hips. Now switch your awareness to the left side. Let that one be the leader of the band. Did things change when you asked that? Maybe if the right is your dominant side, things are now a little less smooth. Because the non-dominant side just gets fewer signals from the motor cortex. So hang out with that and say, okay, we can do this. I know we can. How about backwards? Stay on or go back to the right side and walk backwards. And then switch your awareness over to the left hip. And notice again, did that change the sense of smoothness, the signals? What is different, if anything? And then letting it go. Let's take the arms down alongside the hips. Knees are bent in. Comfortable as close as you can get. And we'll do a half bridge pose. So as you inhale, press the feet down, lift the hips, squeeze the buns, and then slowly release back down. Take a breath in and out. And again, press the feet down, lift the hips. So don't make it your biggest bridge set, but sort of more like an incline. Gentle little slope. Feel the buns are on. And then let them relax as you lower down. Full breath in and out. And one more time. Feet presses down, hips lift. And lowering down. Sliding the legs out. Relax the arms. Pause. So you breathe in and out. Letting there be a sense of the breath moving down, deep in the belly, into the pelvis, into the legs, and arms, even up into the neck and skull. Bringing prana to every nook and cranny of your body. Wiggling fingers and toes. Draw the knees up. Rock the knees gently from side to side. Let's roll over onto one side. And we'll press up into a comfortable seated posture. Closing today with 3 ohms. Om is the sound of prana, of vitality and wellness and energy. And I invite you to not only bring this intention inward, but outward as well, to all that needs an invitation for wellness, for ease. I invite you to bring your palms together. Let's take a deep breath in. Exhale and bow your head towards your heart. Seal in the practice. It is yours. The wellness is yours to share with anybody and everybody you encounter. Thank you for allowing me to share your practice today. Namaste.